provide privacy, hand hygiene. Hi, my name is Rachel. I'm going to be your nurse today. Can I get your name and date of birth, please?
Kyle J. Sanchez, May 23rd, 2000.
Thank you. Today we're going to go ahead and do a head-to-toe assessment. Should take about 15 minutes. Is that okay with you?
Yep.
Okay, thanks. First, I'll verbalize taking vital signs, starting with the radial pulse, then looking at respirations, and then blood pressure, as well as oxygen saturation and temperature. Then I would be doing a general assessment while I do all of this, noting the body posture and his affect, as well as speech and hearing. He was able to talk clearly to me and hear me as well. Then I would note his personal hygiene, looking at his hair, his clothes, assessing his skin, looking for any wounds and evidence of drug use, as well as assessing his nutritional status. And I would also inspect his gait as he walked in. It was stable and there's no use of assistive devices. So next, do you have any pain today?
Yes, I do.
Where is it?
In my stomach.
And on a scale of 1 to 10, how bad?
About a 5.
Okay, and does it stay in that spot or does it radiate?
It radiates and moves around.
Okay, and what makes it better or worse?
Laying down usually helps it.
Okay, how long have you had this pain?
About a week now.
And how would you describe the pain?
It was very sharp and almost like a big bubble of pain.
Okay, well, we'll get that looked at. I'm going to go ahead and move on to the head, neck, and neurological system. So, what's your name?
Kyle Sanchez.
Do you know where you are?
Rachel's house.
And do you know why you're here?
Because my stomach hurts.
And do you know what day it is?
Today is Sunday.
Good, I'd say he's alert and oriented times 4. Next, I will go ahead and inspect the scalp and palpate the neck vessels. I put on gloves to do this. I've been looking for any lesions, any bumps, and any infestations, and it looks good to me. Next, I would also palpate the lymphatic nodules here. Feel good? Any tenderness?
Nope.
Okay. Then I will I will do Perla. Go ahead and look straight off. Take your glasses off. Thank you. And then, good. I'd say pupils are round, equal, round, reactive to light, and accommodating. I'm going to go ahead and look in your ears. I look at the skin on the pinna, looking for any lesions. I will pull the pinna up and back, looking at the tympanic membrane for the gray shininess. Looks good. Do the same for this side. Good. And I'm going to go ahead and look in your nose, looking for the septum and even. Looks good. I'm going to test the patency. Go like this and blow out, please. And the other side. Perfect. And I'm going to go ahead and feel for your maxillary and frontal sinuses. Tell me if you feel any tenderness, okay? Any tenderness?
No.
Okay, good. So next I'm going to go ahead and test the mouth, dentition, and throat. So I'm going to test for TMJ. Open and close your mouth. I don't feel any cracking. That's good. Go ahead and smile for me. Teeth look intact. Do you have dentures?
No, I do not.
Okay. Next, stick out your tongue and say ah for me.
Ah.
Uvula looks good and moves, and I don't see any tonsils. Did you get those removed?
Yes, I did.
Okay, sounds good. Next, I will go ahead and test the tongue. Go ahead and stick it out for me. Move it up and down and side to side. Perfect. And then I would also do the gag reflex here. Then I will go ahead and test your cardinal field of gaze. So without moving your head, just go ahead and follow my pen, okay? Perfect. Okay, and next I will test, those are testing cranial nerves 3, 4, and 6. I will test cranial nerve number 7, facial symmetry. Go ahead and smile and puff your cheeks out. Perfect. And cranial nerve 11, go ahead and shoulder shrug. Perfect. Okay, I'm going to move on to the respiratory system. First, I'm going to assess the respiratory rate and rhythm. They look even and unlabored to me. Will you go ahead and please remove your shirt? So I can inspect the chest, looking at the skin, noting the symmetry of the chest. There's a little concave there, and looks like you have a scar right there. Okay, and I'm just gonna go ahead and auscultate, listening to 6 spots on the anterior, 2 on the sides, and 6 on the back. Every time I move my stethoscope, just go ahead and take a deep breath for me. Good, on the side. Good, and then the back. While I'm back here, I'd make sure to look at any moles or any scars. Also being careful not to go on the scapula. Good. Now I'm just going to go ahead and percuss for CVA tenderness. Tell me if you feel any tenderness, okay? Anything?
No.
Okay, perfect. Let's move on to the cardiovascular system. First, I'm going to inspect the precordium and the neck vessels, looking for any jugular distension, which I don't see any. So I'm going to go ahead and then start to auscultate, starting with the aortic, then going on from there. The aortic, the pulmonic, then skipping Erb's point, going to tricuspid, and then mitral. While I'm here, I'm going to listen to the apical pulse. If it was irregular, I'd listen for 1 minute. And then I'm going to compare the PMI to the radial pulse. Perfect. I would grade those all a 2+. Next, I'm going to go ahead and auscultate the carotid arteries, okay? I'm listening for nothing, if indicating there is not a bruit. Oh, this I would probably have you lay down with their head and chest slightly elevated too. Thank you. Sit up a little bit more for me. Thank you. Good? Good. Okay, that would be also a 2+. Next, I'm going to go ahead and look at your hands. I'm going to note for any cyanosis and clubbing and check the cap refill. Less than 30 seconds. I do that for this hand. Good. I'm also going to check the skin tuber. Perfect. Okay, and we're going to do some strength tests now. Can you go ahead and squeeze my fingers? Perfect. And then push. Good. And pull. Good. Grade those 5 out of 5 and normal. So next I'm going to move on to the abdomen. So you're good just where you are. First I'm going to inspect it, looking for the symmetry and noting any wounds. It looks good to me. I'm going to go ahead and auscultate, starting in the right lower quadrant, okay? All 4 quadrants are very active, and if I didn't hear anything, I would wait and listen for 5 minutes before I noted no bowel sounds. Now I'm going to go ahead and do some light palpation. Let me know if you feel any tenderness, okay?
Okay.
Anything?
Nope.
Okay, good. When was your last bowel movement?
This morning.
And when you voided or had your last bowel movement, were there any abnormalities or changes?
Nope.
Okay. And if he had a uterus, I would go ahead and ask when their last menstrual period was. Let's let's move on to the lower extremities. First, I'm gonna go ahead. Can you sit up for me? I will inspect the feet. Looking, checking for any ingrown toenails as well as the skin on both of the feet. And then I will check for edema. There's none, so I grade that a 0. I'm gonna go ahead and test your reflexes, okay?
Okay.
I'll grade those a 2+. They looked very normal to me. While I'm doing this, I will also be looking at the temperature of the skin, or the color and the temperature. I'm going to grade your pulses, your posterior tibialis, on both feet, and then the dorsal pedis too. I grade those a 2+ and normal. I'm also going to go ahead and check your capillary refill. Less than 3 seconds. Less than 3 seconds. Good. Okay, now let's do some strength tests, okay?
Okay.
Okay. Go ahead and push for me. Good. And push. Good. And push. There you go. And then push against me. Good. I grade those 5 out of 5 and normal. Thank you for letting me do this. Is there anything else I can get for you?
No, thank you.
Okay, thanks.